This lecture will record EMS's role in public health. According to the American Public Health Association, public health is defined as the practice of preventing disease and promoting good health within groups of people. Who better suited to help in this front than EMS practitioners, who are out in the field seeing people in the environments they live in day to day? We do have a big role to play, and I know it may seem slightly counterintuitive, right? Our job is to help them whenever they're sick and injured. So how can we prevent those things from occurring? Easy, and we're going to go through all of that. You are part of the public health professionals. People who are trained in public health examine the overall needs of the population at large to determine the best use of health resources in order to ensure that they have a better quality of life that can last for longer. Examples of some of these efforts are preventing and controlling communicable diseases, immunizations, and assisting people in getting access to immunizations, good nutrition programs, environmental health, monitoring that, regulating and remediating issues that are found in environmental health problems, community planning, and then exploration of social determinants of health. Where EMS can really come in to play is finding people again in their habitats, helping prevent injuries. So whenever we see something that's going to be an issue, we try to fix it. And also submitting to research that can help further public health professionals' goals. So what are some threats to public health that we as EMS professionals see? First of all, injuries. And injuries can be broken down into two different subsets. First, intentional injuries, which is only about 8% of the overall injuries that occur, and then the unintentional ones. The intentional injuries are exactly what they sound like. It's whenever injury or death is inflicted, whether by oneself or by another individual. So we tend to think of this as violent events, whether it's self-harm or harm from someone else. Far more often, what we're dealing with are the unintentional injuries. That's 92%. This is when there's no intent behind the cause of the accident. And that's, again, we refer to them as accidents. Car accidents, trip and fall accidents, workplace accidents. It's not intentional that these things occur. It was something was used in an unintended way, or just things happen sometimes. When we say that somebody is at risk, it's that they are exposed to the potential hazards which can cause harm to them. Risk factors can be anything from age, whether that's very young or very old, the size of a patient, certain safety mechanisms that may or may not be there for that patient. An injury is going to be the third leading cause of death for all age groups across the board. Children tend to be the ones that have the highest risk of debilitating injuries or death secondary to trauma. It is the leading cause of death in children under 19 years old, with gun violence being the number one cause for them. Compared to adults, children physiologically are set up to have poor effects due to trauma. Their skin is a little bit thinner. Whenever we look at the proportion of their head to their bodies, they have a much larger head proportionally to their bodies, which means things like falls or motor vehicle accidents tend to have bigger neurological consequences for these children because their head is going to be a catalyst. It's going to move forward. It's going to move towards the ground first. They kind of like lawn darts, right? You throw them up in the air. What's going to come down first is the heaviest, thickest part, which is going to be their head. This also gives them less ability to protect themselves from harm. They also cognitively are not developed enough to veer away from danger most of the time. And then whenever you get to the teenage years, you tend to be a thrill seeker and you seek out the danger. Other risk factors for children include their age, their sex, their socioeconomic status. So children who come from lower socioeconomic classes tend to not have some of the safety mechanisms that are in place. Older cars, not as top of the line car seats. They may live in an area that's closer to a roadway. So whenever they're outside playing, it's not in a neighborhood where there's less likely to be traffic or traffic going at an accelerated speed, as opposed to living in a more urban area. Each year, about 200,000 children under the age of 14 receive injuries while playing on a playground. So this is also going to be one of those high risk factors. Whenever they reach an age, that developmental stage, that they can go out and they can start playing on the playgrounds. Slide accidents, monkey bar accidents, all of those are going to be issues. And then we can't forget about sports-related injuries. As children start playing sports, both contact and what we would think of as non-contact sports, they open up themselves to those sports-related injuries. Other public health threats are going to be chronic illnesses. So a chronic illness is defined as a physical or mental condition that lasts more than 1 year and causes functional restrictions or does require ongoing monitoring and treatment. More than half of all Americans have had at least one chronic illness as of 2018. This is a significant risk to the public health. So when we look at things like diabetes, hypertension, high cholesterol, visual impairments, hearing impairments, cancers, these are all going to be chronic illnesses that people are dealing with. Individuals that do have multiple chronic conditions have a worse health-related quality of life and thus are a higher health care cost for us overall. Looking at from the economy that we live in the capitalist economy, somebody's paying for increased healthcare costs somewhere. The more people that have chronic illnesses that aren't managed and aren't being treated and addressed appropriately, or they're waiting too long to have them treated for whatever reason, healthcare costs across the board are going to go up, because as an insurance company has to pay more for one person's care, they have to offset that cost by charging more for everybody. It also causes for that individual and their family increased risk of death. The more chronic illnesses we have, the more likely that one of those chronic illnesses is going to lead to death or exacerbate them kind of collectively to lead there. Other public health threats are acute illnesses. COVID-19 is one that we all just kind of went through recently. The flu we go through every year. So it's not something that's chronic, and it tends to be something that's transmittable. So it can be passed from one person to one person, and then kind of spread from there. And it can also come from an animal to a person. So think like Zika. Those are all going to be acute illnesses that we can get. Depending upon what the acute illness is, there may be vaccine programs that can help not prevent a person from getting that disease, but lessen the overall effect of the disease. So where the flu and COVID-19 very much had the ability to kill the host or the person who was infected with it. Instead, if you were vaccinated towards it, you would just feel really crummy, but probably not getting admitted and probably also not going to die from that acute illness. There are some acute illnesses that there are not vaccines or anything else for. So think like the cold. Really no good vaccine. There's just too many strains for it. Other public health threats that aren't looped into acute illnesses, chronic illnesses, or injuries are going to be things that are environmental. So our water becomes contaminated. In the past couple years, the low country area and all throughout the state, actually, especially this past year, I'm recording this like end of 2024, we've had a lot of issues with flooding. The problem with flooding is that at some point our water treatment plants are going to be inundated with water, which is going to cause the sewage that they're housing and trying to process to leak out. That's going to contaminate all of our water supplies. And if you've ever lived in an area that was under a boil advisory, that is why. And when we look at those, the reason that you're under the boil advisory, one, because it's kind of nasty, but two, all of the fecal-borne diseases. So think E. coli, things along those lines where we can get it from fecal matter that's now in our water supply. So we have to boil the water to get rid or to kill the bacteria that's in it before we can consume it. Past that, you can have radiation leaks, anything that's causing the conditions in the area that you're in to become unsanitary or unsafe. Whenever that rail car in Ohio derailed and it was carrying a lot of chlorine, the couple months ago in Georgia, they had a plant that became compromised and caught on fire, and it was housing lots of chemicals. So as public health professionals that are trained in it, but also us as EMS professionals need to be prepared for the likelihood that we could deal with some of these. Why we need to think about public health and public health threats is really boiling down. If you can't think about the health and safety of people and that it's giving them, causing them distress or injury or illness, then we can look at it from a financial standpoint. And that's your YPLL, which is your years of potential life lost. Currently, we have a life expectancy of around 75 years. So when somebody dies prior to that 75 years, we need to think about why and then the impact that's having on our society as a whole. They are no longer going to be paying taxes. They are no longer going to be functioning members of society that are contributing in ways that we find meaningful, right? They're not able to work. Again, taxes. They're not able to give those financial or physical contributions that benefit the greater whole. Medical conditions and injuries result in a lower YPPL than trauma. Now, a decrease in the YPPL does not always have to be from death. So somebody who is chronically ill and then they have to go out on medical disability, or they end up with some type of traumatic event that leaves them where they're not able to fully function. They're comatose. They are fully bedridden, or they do not have the mental or physical ability to interact with society. That is also going to be categorized or classified within that YPPL because they're not contributing to society. And it sounds horrible to say it like that, but it's looking at it strictly from a monetary standpoint. If they are not able to actively work and they are not able to pay taxes, then that is a deduction from our overall GDP that's coming in and looking at that each person making that quote unquote contribution to the society. Where EMS really comes into this are those teachable moments. So reinforcing good messages to the community. Whenever we get called out for something and you have somebody who has diabetes and is poorly managing it, helping get them access to the education. You keep going to the same elderly person who keeps falling, and you notice that they have a rug that they keep tripping over that's between their room and their bathroom. And so far you've gone to them just for a lift assist. They haven't gotten hurt yet, but that possibility is still there. So the next time you go to them, see if you can help rearrange their house, move that rug to take away that injury. These teachable moments 100% can be preemptive. We also see a lot of research that's done that helps with these teachable moments. So better childcare restraint, not allowing you to forward face your child until they meet certain age and height and weight requirements. Seatbelt mandates. All of these are for the teachable moment. So we saw increased injury, increased mortality secondary to the injury patterns. So we start educating. Vaccine drives, the other teachable moment. So disease prevention. EMS's big role in public health is this teachable moment. We are seeing them in their environment. We are able to help educate them, to get them to the resources. And if it's something that we're not able to educate them on, we can 100% get them to the resources that they need. This is the end of the EMS and public health outreach lecture. If you have questions, please let your instructor know.